More questions about who should be getting the COVID-19 vaccine first. Windsor's medical officer of health warns the rollout must follow ethical guidelines, which he says are being ignored.
I miss them. We had lots of fun here together.
You know, I don't think there ever can be closure for something like this.
Remembering bright young lives taken too soon, 1 year after a passenger plane was shot down in Iran. A live look across the river to Detroit. Temperatures sitting around -1 right now. It's been a pretty cloudy week, but we might have some sun to look forward to tomorrow. Colette Kennedy will join us with the full forecast later tonight. I'm Katerina Georgieva. Chris is away. Windsor-Essex hospitals are dealing with backlash for offering the vaccine to managers and executives. Some are outraged, including the local medical officer of health. He says there's an ethical framework, and he says it's disturbing to hear it isn't being followed.
It's not right. There are clear guidance, there are clear criteria, protocols that have been identified. There's a scoring system. It's not a competition to quickly administer the vaccine as quickly as possible. You have to think about the ethics of it. You cannot just go on and say, yes, I have the vaccine. I can start anyone who's walking down the street and start jabbing them with the vaccine and say, hey, I have finished the vaccine. I've completed 5,000 or 10,000 or 15,000 of vaccine because I just did it. It's not that. It's public health decision-making, evidence-based ethics. There are clear guidelines on who to vaccinate and how to vaccinate.
Stacey Janzer has been following this story, and she joins me now live. Stacey, this all started earlier this week when we first heard about a PR exec at Erie Shores getting the shot. And now we're hearing that the shot has been made broadly available to other leaders in hospitals. But there are guidelines around this, so break it down for us.
Well, Kat, the province lays out specific guidelines about who should get the vaccines and in what order. Ahmed referenced those guidelines this morning, saying healthcare workers with a high risk of getting the disease include COVID-19 units, COVID-19 assessment centers, critical care units, critical care response teams, emergency department, and the general internal medicine units. So first you have to belong to one of these groups, then your function within that service must be critical to get the vaccination. And he says there are not any healthcare workers who want, if there are not any healthcare workers who want the shot, he says the guidelines say to not prioritize based on seniority or rank. And if there are extra, Ahmed says to give it to healthcare workers based on the prioritization metrics, not on who wants it.
Stacey, some people might ask, why shouldn't someone working in the hospital get the shot now, since they are working in a building with COVID patients?
I spoke with a bioethicist from the University of Toronto. He says opening up the vaccination to those other than specified in phase 1 is problematic from an ethical point of view.
Quite an ethical breach. There needs to be specific protocols that I don't know how this works, if they're calling people in for vaccines and in fact they find that they don't have enough people for vaccines, there has to be an immediate contingency plan as to how they can access other people in phase 1, not say that, okay, there's no one around for phase 1, therefore we'll give it to this person or that person. This is quite a significant violation. And not only is it a violation, but I would argue that it's going to erode public trust enormously.
I reached out to the hospitals today after the morning news conference with the health unit, and again after speaking with Bowman. Windsor Regional Hospital CEO says they are following the provincial guidelines. In a statement saying, in part, this absolutely includes a priority to vaccinate willing staff from critical areas of our hospital. But this also includes many key leadership individuals who are in our facilities and in contact with patients and colleagues. These individuals are critical to the operation of the hospital. Effectively, we can't lose them in the middle of a pandemic and when our volumes are at or above capacity. And David Moucher, the CEO of Windsor Regional Hospital, says he has not been vaccinated. Hotel Dieu Grace Healthcare says they are also following the provincial guidelines, but they told us that the shot is available to all of their employees. They say 51% have registered for it. Its CEO, Janice Caffer, has not been vaccinated. Erie Shores did not reply to my calls or my emails today, but yesterday let us know all of its frontline workers who wanted the shot have gotten it, which is why they're moving on to other senior staff. Ahmed says his team at the health unit is critical to operations, but no one there is getting vaccinations except for a few who are doing the vaccinations in long-term care. Same with fire, police, and other critical municipal services. They're not getting the vaccinations, but they are essential. He says the direction as to who is a priority has been set out by the province, and that needs to be followed. Kat.
Thanks, Stacey. The CBC's Stacey Janzer reporting live tonight. Ontario will now allow people who are pregnant or breastfeeding to be vaccinated against COVID-19. The recommendations mark a shift from the province's previous policy that hindered access to those individuals. In a statement, the Ministry of Health says that people who are pregnant or breastfeeding may now choose to receive the vaccine after consulting with a healthcare provider. The province previously advised that those individuals should not receive the vaccine as they were not included in the trials. The changes come after a push from healthcare workers and hospitals. Yet another grim milestone today in this pandemic. More than 200 people have died of COVID-19 in Windsor-Essex since this all began. Today, the health unit reported 12 new deaths, 10 of which happened in long-term care and retirement homes. The number of people who have died has doubled since December 1st, from 100 to 202 today. 201 new cases reported today. Our weekly COVID-19 case rate is much higher than the provincial case rate. As you can see with this graph, Windsor-Essex is up top. It's that blue line, followed by the weekly rate for southwestern Ontario in green and then Ontario in yellow. And a look at another number now, 12.3%. That's our percent positivity rate. That's how many of all the tests being taken are coming back positive. Ours is the highest rate in the province, all reaffirming the health unit's message that our region is struggling and needs to get a handle on it. The health unit was asked today if it plans on taking restrictions any further than where they're at right now. But Dr. Ahmed says between the lockdown and his stance on schools, anything further is up to the province. That said, earlier in the pandemic, the city's top doc has taken matters into his own hands before. So let's take a look at some of those times when the health unit went beyond provincial regulations. It happened twice with schools. The medical officer of health sent all students home to do remote learning in December. This was a week and a half before we saw a similar order from the province. And then this week, the health unit said it would issue another order to extend remote learning if the province didn't. But the province quickly followed suit and no order was necessary. Other times, when the province moved Windsor-Essex into the yellow zone in November, the health unit added its own extra restrictions for further safety. Over the summer, the health unit issued its own orders for farm owners as the virus hit the sector hard during the first wave. And also earlier this year, the health unit issued a mask directive when the province had not. I spoke with an expert in public health for more on this. Here's what they had to say.
I think there are two things going on. One, the province should be taking more leadership, should be taking more concerted action. And when you see local public health units like Windsor-Essex taking stricter measures regularly, it's a sign that the province isn't being responsive to the need. And because they're not the only health unit doing that, the other implication is that there is an important role for local public health. Sometimes there are local circumstances that are just different from what's happening around the province, and that's okay. Our system should be able to accommodate regional differences in what's happening with COVID and how we respond to it.
That said, this morning, Dr. Ahmed said he thinks the province has done a great job at making the right decisions at the right time. Mulligan, who also sits on Toronto's Board of Health, says it's not really in the health unit's nature to criticize the government and that it's trying to maintain good relationships during a very fraught time. It's been 2 weeks since all of Ontario was moved into lockdown, but the number of new COVID-19 cases continues to climb. Today saw another record, and the Premier is warning what's coming next could be worse. Queen's Park reporter Mike Crawley has more.
We are in a crisis. That's how I can describe it. It is scary.
In Premier Doug Ford's voice, a deep sense of concern, perhaps even fear.
This is so serious. Matter of fact, this is the most serious situation we've ever been in, ever, since the beginning of this pandemic.
Just how serious? Hospitals across Ontario have been ordered to prepare for large-scale transfers of patients as the COVID burden grows. The province is reporting a record 369 COVID patients in intensive care and more than 4,200 new cases today, another single-day high.
Today's numbers are, to be frank, they are scary. We need to consider all possible measures to contain this infection. We don't want more people dying. We don't want the ICUs overwhelmed.
Ontario is already forecasting the ICU caseload from COVID-19 to exceed 500 this month. More detailed projections are on the way next week, and Ford says there'll be a wake-up call.
We're in a desperate situation, and when you see the modeling, you'll fall off your chair.
Ford is putting the blame for all this on people who aren't following public health guidelines.
If these basic measures continue to be ignored, the consequences will be more dire. The shutdown won't end at the end of January, and we will have to look at more extreme measures.
Despite the urgent tone, no new measures announced today, sparking criticism.
All we got from the Premier today was saying Ontarians need to wash their hands more. I'm sorry, but that is a complete failure of leadership.
Once you're in a crisis, the political risks are lower because everybody's sort of saying, for God's sake, do something.
Meanwhile, hospitals in southwestern Ontario are using refrigerated trucks to store bodies. Vaccines aren't getting distributed quickly enough to slow the onslaught of new cases, and Ontario's version of a lockdown drags on with no end in sight.
That was Queen's Park reporter Mike Crawley. It's been 1 year since Ukraine International Airlines Flight 752 was shot out of the sky over Tehran, killing everyone on board. Among the dead, 138 people with ties to Canada, including 55 citizens and 30 permanent residents. The Prime Minister paid tribute to the victims today.
To the family members and friends who had planned to pick their loved ones up at the airport, to everyone who was looking forward to seeing your beloved partner, child, or parent, I cannot imagine your pain.
The passenger plane was shot down just minutes after takeoff from Tehran. All 176 people on board were killed. Iran later admitted its Revolutionary Guard shot down the plane. It has offered compensation to families for their loved ones, an offer Ottawa's Special Advisor Ralph Goodale has turned down. 5 of the victims lived right here in Windsor. As CBC's Tamina Aziz reports, the pain is still raw for family and friends.
They were students, researchers, and spouses. This time last year, Windsor lost these 5 bright minds. This is where people come to remember the victims of the plane crash, set up by the University of Windsor and the city late last year. Family and friends still grieve the loss.
For everybody that knew people on that plane, it's hard to believe that it's been a year. It seems like it was yesterday, really.
Lisa Porter worked closely with one of the victims, Samira Bashiri, at the University of Windsor, working on a cure for cancer. How are you going to remember Samira?
We don't actually need things to remember her. She impacted all of us tremendously. She came here and wanted to show the beauty of Iran, and she shared the beauty of Canada and our traditions with her friends back home.
She says 2020 was a tough year, the worst day being when the crash took place. She says so much potential was lost on that plane and won't forget this tragedy.
You know, I don't think there ever can be closure for something like this. Certainly not for her parents and for her loved ones. There never will be.
Marzia Abbas Burgadi visits this memorial once a week, bringing flowers with her. She lost her brother Mohammed Abbas Burgadi and sister-in-law Zara Najibi to the crash. She sits on the bench dedicated to them and talks to them.
I miss them. We had lots of fun here together in the same place. And I really wait to meet them again somewhere.
Canada remains skeptical of Iran's investigation into the crash. While Iran says it has set aside $150,000 in compensation for each victim's family, the Minister of Public Safety says Iran's compensation offer is at best premature. Some families call the offer hush money. Here in Windsor, Abbas Burgadi says she appreciates the memorial and its setup. It allows her to feel their presence and communicate with them.
I really like the idea of trees because both of them, Zahra and Muhammad, both were really fond of nature. They would always go to nature. They have fun in nature. So I know that they also like the tree idea.
Mehrdad Saif would see all the students on campus. He recalls the day of the crash, saying it was unbelievable, shocking, and sad.
We all gathered together, many of the students were in tears and really dealing with the loss of their friends, and some of them, they were family members. These students are the cream of the crop, from Iran. They are typically excellent students, and that's how they get admitted to universities in North America.
He says while there were other big world events in 2020, for them, this one will not be forgotten.
This event certainly brought the members of the university, engineering and science, and the students together.
The university is setting up a scholarship in memory of the victims, offering some financial assistance to Iranian students, which Saif expects will go on for years to come. One local community leader says an event was planned to mark the anniversary but got canceled due to the lockdown. Instead, people are sharing their condolences and warm messages on social media. Tamina Aziz, CBC News, Windsor.
You can read more on this online, the lives lost and how they're remembered. Just go to cbc.ca/Windsor. Windsor continues to have one of the highest unemployment rates in Canada. The city's jobless rate rose to 11.1% last month. That's tied for third worst in the country. Nationally, the jobless rate ticked up just slightly to 8.6%, shedding 63,000 jobs in December. The CEO of the Unemployed Help Center says fear of COVID-19 is keeping some people out of the job market.
People are afraid to take a job where they're going to be exposed. They're not comfortable, and they worry about picking up the virus and then bringing it home to their family. We're learning that a lot of our clients, if they haven't caught it, that some of their family members have. So they're seeing firsthand their loved ones going through COVID. They're watching a family member suffer that's had COVID. So that also scares them.
MP Brian Massey is putting together an amendment to the Federal Aeronautics Act as a way of saving air traffic control at Windsor Airport. The amendment would give the Transport Minister the power to veto any decision made by NAV Canada to eliminate the controllers.
Well, it takes away the excuse from saying that it's just basically a one-off deal and allows us to look at a more comprehensive way to look at our airport. So right now the legislation is based upon an old model. This gives the minister power, so if he feels confined right now, he no longer has to stick to that.
NAV Canada is a private company that handles air traffic control across the country. It intends to study Windsor Airport's flight statistics to see if it still qualifies for controllers. The current legislation doesn't give the Transport Minister enough power to intervene. Massey and other area stakeholders say the loss of air traffic control would devastate the airport and the local economy. Massey held a Zoom meeting today to discuss the issue. The number of flights in and out of the city, they don't meet the NAV Canada threshold to keep air traffic control. But leaders say it's a busy airspace because of Detroit. Massey believes the new legislation could be ready in about a month for the government to consider. Another live look at our city when we come back, your weekend weather forecast. And rumor has it, it'll be sunny. Colette Kennedy joins us right after the break. Colette Kennedy joins us now for weather. Colette, it's been a week of will the sun come out? Will it not come out? What do we got for the weekend?
Yeah, and I'm sick of playing this game with this very stubborn cloud cover. You're so right. And, you know, now the skies are clearing. I mean, the sun set just a little over an hour ago at 5:17. So it's about 5-6 hours later than I admit. I thought we would be clearing a little bit earlier today. Finally, it's coming, but yeah, not with the benefit of some of the sunshine. So wind chill factor that we have here, and with the clear skies, we actually get some cooler air moving in. It feels like -6, feels like -9 at the moment for Chatham-Kent. You see it. It really is happening. There's the satellite imagery and those clouds moving out. And I will tell you that there is still one of our models that is looking like it wants to push cloud back in, really thick stuff for tomorrow. I am not going with that. What I am seeing, and I am an optimist, but what I am seeing is that we will get into more significant clearing and then kind of a variable sky. So there may well be, I expect some higher level cloud there, but it still gives us the brightness. So we should have some of that into Saturday. So it's at least an improvement of where we've been for a few days. And finally, get a little bit of vitamin D, finally get those sunglasses ready. Anticipating you will be needing them. Now, as we look towards Sunday, I will say, and you can see it right here illustrated pretty well on the imagery here, that we'll have some cloud cover early part of the day, should get some clearing into the afternoon, or at least becoming more of a mix, and then the clouds thicken back up. But I think one of the most important things here, I don't want to bury the lead, is the whole idea of active weather. We don't have any. I don't see anything really coming towards us till, say, the end of next week. And at this point, it's looking like some wet flurries. Don't want to get ahead of ourselves because that's still a ways off in terms of the forecast. But it's going to be a quiet weather pattern. So, yes, it's going to feel a little bit cooler as we get the clearer conditions, lose the blanket and some of that insulation. But still, in general, we've been seeing our temperatures running above seasonal. And boy, look at this. We're going to be on the mild side for tomorrow afternoon if we get some of that yellow stuff coming back. Remember what it looks like? Sunday, there you go. Still mild-ish, not as warm as Saturday with the extra clouds kind of rolling in. And then into next week, not only is it an inactive pattern, but we're also talking about those temperatures, especially the daytime highs, either seasonal or in this case, a little bit above, as we're going to stick just a little bit above the freezing mark each day into next week, Kat.
Sounds good, Colette. I appreciate that optimism. I like seeing that sun, and here's hoping nothing gets in the way of that.
Exactly.
Thank you so much.
Well, I'll be back here on Monday. We'll talk.
Sounds good.
All right.
Thank you. When we come back, we'll bring you the latest from the United States following the violent attack on the Capitol earlier this week. Stay with us. This just in, Twitter says it has permanently suspended President Donald Trump's Twitter account, citing risk of further incitement of violence. This following the violent attack on the Capitol earlier this week. Meanwhile, Trump says he will not attend the inauguration of his successor, Joe Biden, but the announcement may be a moot point. The effort to remove Trump from office is becoming more determined, even within his own party.
He swore an oath to the American people to preserve, protect, and defend the Constitution. He acted against that. What he did was wicked.
Democrats want to invoke the 25th Amendment. That allows the vice president and the cabinet to remove a president who is mentally or physically unfit for the job. Leading Democrats say if that doesn't happen, they will move ahead with a second impeachment proceeding against Trump. He has less than 2 weeks left in his term. That is it for CBC Windsor News. Don't forget, for news anytime, you can go to our website, cbc.ca/Windsor, or on social media as well, Facebook, Instagram, and Twitter. The Rick Mercer Report is up next. Have a great night.